Hello, I'm Cassie, and I have the pleasure of interviewing Dr. Michael Wald, who's been nicknamed the Blood Detective, for his keen ability to zero in on health problems and find natural solutions. Dr. Wald, you also hold several degrees and certifications, including board certifications in nutrition. Today we've been receiving some emails on our topic of diabetes.
That's a good one.
Kathy has sent in an email in which she states that she has been diagnosed with diabetes type 2. She would like to know what else she could do besides medication to help herself, and she also wants to know if she can ever cure her diabetes.
Okay, well, we don't know what Kathy's age is or what other, health issues are there or what she's done, but we'll stick with the topic of type 2 diabetes, which is non-insulin dependent diabetes. If I had to choose what type of diabetes is the most successful of either curing or favorably managing, it would be type 2 diabetes.
Okay.
So type 2 diabetes, like type 1 diabetes, has a component of autoimmunity and genetic predisposition. Some think maybe a bit less than type 1, certainly, but it doesn't matter. What does matter is that if we recognize there's an immune element there, when we work someone up with lab work and that sort of thing, we can look for specific immune parameters and then manage them as naturally as possible. So she'd like to know, Kathy would like to know, besides medication, what she could do. Well, again, I don't know, Kathy, what you've tried in terms of your diet. A lot of people, when they recommend a medication, whether it's metformin or otherwise known as glucophage, and there's all sorts of other medications for that, many people sort of give up and they don't even think about diet and exercise because they feel that their medications are handling everything. In Kathy's case, I doubt that's the truth. And even if it were true, that would be a very sad way to go, because we are going to give up a lot of health potential if we don't pay attention to those issues. Diabetes is a very, very severe issue, and it causes premature death and disability. And we don't have very good treatments for it. The largest group of new diabetics are adolescents these days. So it's always associated, or almost always associated, with overweight or overfat. A person can be of normal weight and not appear overfat, but when you measure what's called body composition or do a bioimpedance test, you find that the percentage of muscle water fat is not good. They have too much fat relative to muscle, and that causes insulin problems and insulin resistance, which by definition is what diabetes type 2 is. Now, in terms of what Kathy can do to treat or help, cure diabetes, first of all, is it possible to cure it? I don't know Kathy's case specifically, but yes, if a person has not tried the proper exercise, if they have not tried to manipulate their diet, then there's all that possibility that they might actually be able to cure their condition. The diabetes type 2 is often genetically predisposed, but environmental factors like poor diet will have the genetic predisposition show up, but it can be suppressed. And that's called epigenetics, by the way, where you can manipulate the diet and you can suppress the expression of certain health problems that one's genetically predisposed to, like diabetes. So as many of our listeners could imagine, cleaning up the diet's the place to start. We want to focus on low glycemic foods. Many diabetic patients that I've spoken with, Cassie, they've never even heard of the glycemic index. They don't even know what that is, and they've seen endocrinologists and dietitians. So that I'm baffled by. So if you don't know what a glycemic index is, look that up, look up on our website, and you want to consume foods that are low on the glycemic index scale. Also, food allergies can cause blood sugar problems. So we might do food allergy testing. Stress can, just emotional stress, even physical stress, changes hormones and can affect how our body manages blood sugar. It's been recently identified, a couple of years back, that certain pollutants in the environment are actually known to increase the risk of diabetes. Pollution.
Wow.
We're not even talking about diet. So we need to look at all of these different factors. Now, when we deal with a patient here, we use our blood detective technology, which is a software program where we enter in a lot of parameters, laboratory parameters for our patients when we design programs, and it uniquely lets us know, or helps us know, in addition to other things that we use, like questionnaires and a lot of the standard things used in medicine to figure this stuff out, what the unique nutritional and dietary needs are. Now, just because a food on some list says it's low glycemics, which means it shouldn't cause much of a sugar problem, doesn't mean it won't in an individual. So we spend the time to figure that out based on individual responses too. This is an area of confusion where people think they've done all the right things and it's not working. We're not textbooks. It doesn't mean that if we've tried things the way the textbook says and it doesn't work, that it can't work. We just have to figure this out. So we're literally writing a new book on every patient that comes in here.
It's an individual plan every time someone comes through the door.
But there are certain things that are basic,
Sure.
like considering those different areas that I spoke about. What is the person's intake of unrefined processed sugars? That of course has to go. A white flour, that sort of thing. Processed foods are usually never good. The use of certain nutritional supplements like cinnamon and chromium and more protein. These are just a few examples of sort of the adjuncts on top of the diet and exercise, which are the most important two aspects of controlling, reversing, and curing diabetes. Diet and exercise. We need to focus there. Again, there's more on the website about diabetes.
Fantastic.
Okay.